Well, welcome back to HWL Talks, where we meet with healthcare leaders and innovators from all across the country and all walks of life. This week for episode number 5, I'm extremely fortunate to be joined by Carey and Liz from AAPPR, and they're going to introduce themselves in a second and share a little more about their organization before we dive in. But having gotten to know these leaders over the last many years, the things they are doing to empower their members and drive change within, healthcare and specifically within the recruitment space of physicians and providers is absolutely amazing. So we hope that you really enjoy today's discussion and are able to learn something from it. For those of you that have not joined us before, my name is Trevor Strauss, and I am the host of HWL Talks, and we're looking forward to a great session. So Carey and Liz, why don't you guys introduce yourselves a little bit? Share a little of your story, right? Like how you got to AAPPR, like kind of a little bit about what your passions are, and then we can talk a little bit more about your organization, but some other really key things that we've chatted about before today.
Okay. Liz, do you want me to go first?
Yeah, go for it.
Sure. So hi everyone. I'm Carey Goryl. My title is the CEO for AAPPR. I've been here for 9 years. My background is in association management. If there is a profession, there is likely a professional or trade association to go along with it to advance that profession or trade. I have been doing this work for 20 years, supporting whether it was nurses, now it's physician recruiters, and my background started in social work. And I have been doing that ever since. It's social work, and the work that I do is about community building, which is what we do at AAPPR, is we build a network of people to learn and grow from. And it's a pleasure being here today. Thanks, Trevor.
Thank you. Liz?
I am Liz Mahan. I'm the Director of Professional Development and Solutions at AAPPR. I have quite a varied background. My undergraduate degree is in Russian and Eastern European Studies. I have a master's degree in theater management and producing. I spent 10 years in New York working on Broadway, off-Broadway national tours, managing theatrical shows. And after just hitting the burnout point, I was looking for a change. And for the first time, well, maybe not the first time, but like one of a handful of times in my adult life, I listened to my mom and I applied for a job as a physician recruiter for a health system in Western Massachusetts. I was there for 5 years and I was just looking for a change to stay in the field of physician recruitment. I really loved the work. But I wanted to grow, and I wanted to grow in a different direction. And I mean, it was like within a month of my kind of mentally making that decision that I got the email from AAPPR where I was a member looking for an in-house physician recruiter to join the associations. So I applied, and Carey hired me. And thank you again, Carey. I think I thank you every couple months. And I started in this role on, I'll never forget the date, March 23rd, 2020.
Great timing.
Yeah, it's hard to forget that particular time period in history for a number of reasons. But so I've been here just over 5 years, and it's been awesome. I love it.
I think it's great.
Yeah, Trevor, I think it was like a whole year before Liz and I ever saw each other in person. And I remember airport. It was like, oh my gosh, a big hug. Here you are in the flesh. Of course, I think we still had masks on and whatnot. We weren't really sure what we looked like, but
yeah, it was Bozeman, Montana. And yes, it was like at least a year, maybe like more than a year. But we were like, you're taller, you're shorter. Like all the things you say when you meet someone in person for the first time.
Well, I think here's what's great, right? Like what I was going to say was, even in your introductions, in the world of physician recruiting in particular, right? Physician and advanced practice recruiting, for the most part, you don't go to school to do this business. And most of us fall into the world through one way or another. Now, I've got to imagine dealing with Broadway actors and dealing with physicians has some good similarities and some differences, right? So that probably taught you a lot on how to do this. But what I've loved in my 18 years, and also being involved, from my side of the business with AAPPR over that time, is just seeing how amazing the organization has been in engaging with the staff, right? Like I think that you guys get a lot of credit for your reporting, your surveys, the different things that you help people just kind of understand from benchmarking about what is happening in the space, where I think you guys have done an amazing job. And I'd like to touch on a little bit to start us off is kind of that evolution of where the industry is going and what that means for you all in your roles and for the members. Because I think you advocate so much, you bring so much to the table to help, whether you're a new recruiter, like, Liz, like you said, like the first day you come in, understanding what the business is, all the way through somebody who's maybe done it for 18 or 20 years and in some ways may have certain things down pat, but they need to continue to learn. You all have done a lot of amazing things, especially since COVID, right? You were telling the joke about not seeing each other for a year, not spending time in person. I think you guys really evolved in some of that with how you engage with the membership post that time. And so I'd love to hear a little bit about your thoughts of kind of what you've seen for your members. They need the data, they need the benchmarking, but what other things are you seeing them ask for? Is it the collegial environment? Is it learning about different aspects of the business? Is it certifications? What are you seeing be most important to the members?
Hey, Liz. So in thinking about Trevor's question, you remember, have you ever heard the statistic that there's a physician shortage?
No.
No, you never heard it?
Are you serious?
And remember, it was a couple of years ago, it was like, okay, yes, the physician shortage. Yes, we know we have one. Liz and I are looking at each other and we're like, okay, and what are we going to do about that, right? Right before we started the recording, we were talking about Liz's title, Professional Development and Solutions. And that came about because it's not about just talking about the problem. It's not even about just telling people what the data is. It's like, and so what do you do about it? Right, Liz?
Yeah. You mentioned COVID, and again, I just started in this role at the beginning of COVID, but I learned really quickly, like you said, you don't go to school to become a physician recruiter. It's soft skills that you already possess, and then you sort of learn the hard skills to do the job as you go. I think what COVID taught all of us, whether we had been doing physician recruitment for 20 years at that point, or we had started a week before, was this is an unexpected thing. Like things that you never thought you'd have to deal with, suddenly you have to deal with. And in that moment, it wasn't about the research AAPPR had done. It wasn't about the data and the statistics or telling a story with that. It was about figuring out together how to still do our jobs and our work effectively in this environment that none of us had ever been in before. So I think in that moment, a lot of the members and the staff, we just realized how strong we were collectively as an association, leaning into our membership, members talking to one another, working with our partners in the industry to navigate these changes that were completely unforeseen, and still knowing that we had to find those physicians to care for communities, particularly in the moment of a global pandemic. And coming out of that, I think that is still one of AAPPR's strengths, and I think that is still one of the benefits our members value most greatly. Like beyond the numbers, beyond the data, beyond the research and the white papers and the certifications, is having the ability to connect with other people who do the same work, to talk about what they're seeing, to brainstorm solutions, to say, hey, I tried this and it didn't really go as planned, and have somebody on the other end of the phone say, did you try it in this way? And maybe you'll get a different result. So that sort of the sum of the whole is greater than its parts, kind of mentality. I think that's definitely one of the strengths of AAPPR.
Right, because developing a community of competitors, of people who are competing in the same pool of physician candidates, can make things very tricky. Nobody wants to give away their secret sauce when it's working, but being in AAPPR and finding other contacts that you can develop rapport with and learn some of the secret sauce, or just what are the resources, who are people I can ask. Liz, we were talking, it's like, it's not that over the last 10 years, the needs of physician recruiters have changed all that much. The shortage has been, the supply is what it is. The rural will continue to have the struggles of how to attract a wide audience to their communities. And like everything has their challenge. But what COVID taught us and everything else since then and before then is that circumstances change.
Right.
You need people that can help you navigate. Well, have you ever had this circumstance of everyone in my C-suite has just been laid off and I've got to develop brand new relationships with everybody all over again? How am I going to do that on top of everything else? Getting that encouragement is really key that we do at AAPPR.
Yeah, Carey, you and I were just talking earlier this week about physician immigration and how that can be really stressful for candidates and recruiters. And just in the last few months, we've seen additional changes and challenges around immigration, and having our members be able to connect with one another and say, I'm getting these questions from physicians and I'm not entirely sure how to answer them because circumstances keep changing. We're still getting answers and clarification, and being able to talk it out first with one another in a safe space. I think it just gives them the confidence and, sort of ability to have some of those more difficult conversations with candidates and feel a little bit more comfortable doing that.
Well, and like you guys said, you have such a huge group of people that come together. Obviously, you're just coming off of your annual conference. And, I wasn't able to attend this year, but got a lot of rave reviews, of course, as always. And, it is a great event every year to bring people together. And I think one of the interesting parts of this dialogue, too, is that, in kind of the sphere that we live in, right, or I grew up in over the last 18 years, we all know everything the association does. Everybody knows you. They know the leadership you guys have brought. But what's very interesting is we're seeing the dynamic shift where, like you said, Carey, how do I deal with a whole new C-suite? Well, how does the C-suite deal with you and your members? Because it's not just about the member meeting the C-suite where they are. The C-suite needs to meet the member where they are. And if they want to get more involved, which is great in certain ways, right? There might be times where it creates challenges with understanding who's doing what. But I'm sure you've all seen your members also talking about the need to engage with new leaders, bringing themselves to understand what is physician recruiting. Why does that matter, right? Because we've all been on the calls. We all have partners who have said, yeah, I got a phone call from GI. They said they need somebody in 6 days and they just expected me to fill the job. There's a lot of misnomers about what it means to be in the physician recruiting seat. Some people think it's a very tactical job when we all know it's very strategic. Some people don't necessarily understand. This is your front door. This is your care delivery. This is your operational delivery. This is your financial delivery of the future that the physician recruitment team in many cases are bringing, especially like you said, Carey, in rural America. So have you all seen maybe new interest levels or new dynamics, or maybe there was some even new presentations this past year at the show about how you interact to have that strategic seat without getting pulled away from the day-to-day that you need to do, right? There's the hamster wheel effect of doing the same thing over and over again, which can bore the members. But there's also, if you get too deep in the weeds with other things, then you can't focus on what actually needs to get done in recruiting physicians to the market.
How's that saying go? You get to eat an elephant one bite at a time?
Yeah.
Priorities, prioritizing. What needs to be done? Because Trevor, you've mentioned so many all competing and one could argue equally important activities that physician recruiters face.
Yeah, I think with regard, it's about telling your story, right? With regard to the C-suite. The C-suite tends to notice, I think, physician recruitment, like you said, Trevor, when we need a GI doctor in 6 days and it's a crisis. We talk less to the C-suite when we're not in a moment of crisis, when we've just had that success and we have found that physician that we have been looking for a year. And now, we have filled this need. They're a phenomenal fit for the organization and the practice and the community. And then, like Carey said, it's prioritized. We're on to the next thing. So, I always think it's really important, and I always encourage members to take the time to talk about the successes and how they got there. Like, not just in a reactionary way when you're in the middle of a search and you're trying to explain to the C-suite why it's taking so long to fill this position or why you can't just make a GI doctor appear in a week and hope that everything goes well. It's important to talk about the journey that you took to get that really great hire that just started and, really advocate for the work that you're doing. It's hard in physician recruitment because it's not a revenue generating department in any organization.
Right.
And at the same time, they're responsible for bringing in all of the people who do generate the revenue.
Right.
So, it's really a double-edged sword, but really trying to lean into those successes that you're having, all that good work that you're doing when you're doing it and telling that story as opposed to feeling like you're in the hot seat when somebody from the C-suite calls and says, why have we had this urology search open for 9 months and we haven't hired a candidate yet? Just being proactive about it, and it helps to build trust. And I think that's what any great relationship is really based on.
One of my favorite stories of someone who was trying to get the attention of the C-suite, they didn't really, this one particular leader, they didn't quite have their attention. It was sort of like they weren't a barrier, but they weren't really an advocate either. And there was a long search. And after it got filled, they sent a bouquet of flowers to their C-suite person and said, "Congratulations, we did it." And the person was like, why did you send me flowers? Because it got their attention. So much so that then they followed up like, why did you do this? And then it was an opportunity for this recruiter to talk about, well, here's what happened. And just sort of highlight. And because insert whatever support that person did, no matter how minor, right? Reward the behavior that you want to see more of, celebrate the behavior and the engagement, the partnership that you want. Even just emphasize those pieces in the hopes that it will grow into that. Sometimes when you treat that with celebration, they got such a positive response from that. I always thought that was a really neat story to get someone's attention.
I love that. And like you said, Carey, it's eating the elephant one bite at a time. Sometimes it's not necessarily going right to the C-suite, but it's about finding those champions within the organization. So whether that's, somebody who's leading a practice or the chair of one of the departments that you're working with, if you're under HR, if it's, maybe the VP of human resources, it just helps to spread the word of the work that you're doing. That goes a long way too. Sometimes it's just really hard to get to the C-suite depending on how big your organization is. I mean, I think we asked, Carey, I forget what conference it was, but somebody asked who had their C-suite, like to raise their hand if they had somebody from their C-suite on speed dial, like on their cell phone. And half the room raised their hand, and it was like everybody from like a smaller hospital. And then,
called and in the presentation, got their C-suite on the phone during the presentation.
Yeah, and then you had like the other part of the room that was like, I see my C-suite like once a year when they're giving like a state of the organization address, and they're about this big, and they're on a stage right up in front of me, and I never talked to them. So so you kind of got the larger organizations a little jealous that happened. And it's not to say that that's not a relationship that you can't build, but it's just going to be easier for some than for others.
Yeah, well, I think that's true, right? Depending on your organization size, if you're in a 50 hospital system, you're not getting a hold of your CEO or CFO all day long. You have to build those relationships, though. And I think one of the things that I'm curious about a little bit for, you all and for the members, right? As I mentioned early on, I think a lot of the stuff that you guys do around advocacy, education, engagement, and kind of dealing with the changing workforce times is great. But there are macro factors in our environments, whether it be mergers and acquisitions, whether it be regulatory environment, reimbursement environment, that affect what your members are dealing with day in and day out, right? And it can become very painful at times, with even downsizing of teams or asking to do with more, or nope, you can no longer have those partnerships type of thing. Is there anything that you're seeing on, whether it be on the horizon or the discussions with the members around how to tackle some of those things that are out of your control? Because I think I've talked to a few of the listeners of the podcast, and what they've liked is getting kind of a few actionable items that they could try. You've shared a couple, but when we think about the stuff that, if you're sitting in that recruitment role and you're doing an amazing job, but there's an acquisition of your health system, you're kind of out of control. You don't know what's going to happen. Mm-hmm. Have you seen any commonalities or things that members have shared with each other to help people get through those types of things?
No, some of those things are just tough.
Yeah.
They're cyclical and they happen at different organizations at different times. Like you said, they're macro. Right now, we've got tariffs, or maybe we don't have tariffs. We've got cuts. Maybe we don't have cuts. There's a lot of uncertainty, and that's not unique to today, but certainly experiencing that today. So how do people deal with that? I don't mean to be too humanistic in my response, but I can't help but go back to it's why you need a community of other people who understand what it is that you do. I was, the conference survey result, someone said, I finally, got to be in a room full of people where I didn't have to explain ad nauseum what I do, and they just understood without me even having to say anything. I mean, that's really, really powerful. I don't know if Liz, you had a different thought on that.
I mean, yes and no. When I talk to members, a lot of times, roundtables or discussions, what we keep coming back to is, as a profession, we have to get out of the habit of being reactionary, of just dealing with things as they come to us, and to start being a little bit more strategic and a little bit more proactive in things, right? Like Carey said, maybe we have tariffs, maybe we don't. But instead of sitting back and waiting to see what happens, making some contingency plans now. I mentioned immigration as a landscape that's also changing a lot. Instead of waiting for the physician to call you concerned or in a panic about what's going on, having those conversations in advance with, your immigration attorneys or your senior leaders about how you're going to address this, how you're going to respond to candidates. We can't change a lot of these things. All we can change is how we respond to them. Mm-hmm. So trying to get out of that minutia and that I have to do all of these things today, and just take a look at the larger landscape that's happening around us, I think alleviates a lot of stress in the long run, because you're able to think about it and plan for different outcomes instead of just doing your best to respond to what's being thrown at you.
I mean, Liz, it's amazing how resilient we've seen members be, and how much they can pivot and react and adjust and be patient and be patient and be really patient with all these changes. One of the things I think it's really important to note is just, again, self-care. Because when you don't have control, the only thing you do have control is yourself and how you react to those situations. I mean, a lot of people work from home, or they work from home still a majority of the time in physician recruitment. And so just making sure that your job isn't the only thing you have going on, especially when you work at home, because then it's so easy when work is always right there and the work never ends. There's never, I've got everything done on my to-do list and I can be done. There is always something else to do. So just making sure that you always have something else in your life that pulls you and draws you away. Don't let work be the only thing that's got a pull on you. Build other things in your life that do. And that is going to then help your resiliency, right? We all know, you got to fill your own bucket. You got to put the oxygen mask on yourself first before you can help anyone else. And that includes helping your organization find a physician. You got to have a strong, solid foundation yourself.
Yeah, I mean, I think that is great advice to kind of end today. It's one, you got to keep it simple, but this is a human business. So, Carey, when you said you didn't want to be too humanistic, that's what our business is. AI is not taking our jobs. It's going to augment our jobs, but it's not going to take them.
Right.
But we are a human business. At the end of the day, we're humans taking care of humans in healthcare. And so I think it is huge, not just for your members to hear these types of things, but also for some of the other healthcare leaders that we have on here who aren't as familiar to what the physician recruiters are dealing with every day. They kind of probably just think their job's easy. Oh, I'm taking physicians out for dinner, or I'm taking, CRNA out to, see the town. And they just think they're touring people around. And that's not what this business is. And it's truly a profession. And I applaud you both and your entire organization for what you do to help educate others who aren't in the space. Unlike, Liz, like you said, that person who came in and didn't have to explain what their job was. You're working to advocate that because this is a very, very vital profession to healthcare delivery. And, I don't care if you're a CEO or a CFO or a COO or a CNO of a health system, without your physician recruiting team, you aren't going to be able to care for the patients in your community. So just want to applaud you guys for everything that you're doing. Your membership is extremely engaged. We love being able to go to the events and see everybody and learn with you all as well. So thank you so much for joining us today here on the podcast. And is there anything left that you'd like to leave our listeners with before we sign off?
Oh, that's a really, really big question. Follow us on LinkedIn, AAPPR. Go to our website, aappr.org. Consider joining us if you're a leader and you have physician recruiters in your organization. Support their membership, support their participation. Our members who work with us use our data, who stay involved. They make their organizations just hum and soar. So it's worth it.
Thank you both so much for the time today, and hope everybody enjoyed listening to episode number 5 here on HWL Talks. Hey everyone, hope you enjoyed our session this week with Liz and Carey from AAPPR here on HWL Talks. Please certainly follow us for upcoming content as we continue to talk to healthcare visionaries and leaders from all across the country in different aspects of the business. We love having you here, and we look forward to seeing you next time.